طيب, we can start. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good evening, everyone. Good afternoon or good morning, wherever you are. Neurology Solutions is happy to sponsor this event, which is organized by the Academy of Sciences. I am Dr. Albarrak. I am a epileptologist, intraoperative neurophysiologist. And tonight, we're having a very special speaker, Dr. Fawzi Babtain. He's a neurologist, epileptologist, a clinical neurophysiologist, and epidemiologist at King Faisal Specialist Hospital and Research Center. Dr. Fawzi is interested in medical research and having many publications. Tonight, we'll have an interesting topic, which is how to use the AI, artificial intelligence, in medical research. So this webinar would be 1 hour duration. The first 50 minutes would be a presentation by Dr. Fawzi. Then the last 10 minutes would be for the Q&A session. So please, if you have any question, you can write it in the Q&A section. And at the end, we will discuss these questions with Dr. Fawzi. Dr. Fawzi, the stage is yours.
Hi, Bismillah. Hello, everyone. You can hear me. Some people just said there is a problem with the audio. So I will start unless you will tell me there is a problem with the audio. I'm very pleased, Hagiga, to be here. This is Anas' idea of let's talk about AI medical research, which is really fun, which is something that we should get into. With no further ado, this will be about 15 minutes talk. Before we start, I want to excuse my bias as an epileptologist. I will drive you through this in a simple example, not very complicated example of how to take one research-related issue and go through this trip. I hope it will not be so complicated from, as an epileptologist, but it should be inshallah doable. So the title is how to use the AI tools in medical research, and everyone is really aware of what's going on since November 2020. These are my objectives. We will start with why AI, why to use AI, and how would it help us. And then a lot of really points in the talk here will be about you as somebody who's interested in research. You are the one who had basic research skills. You are the one who had an access to an e-library with or without full access articles. You are the one who had the creativity. You are the one who really initiated this. So AI will not do anything without you. So it is you, and then the AI will support you. So there is some interesting relationship between you and the AI, for which let's explore this. To drive here, you have to have an idea. You have to have a knowledge, and then we will go through the usual no-brainer steps, how to execute a research, starting with research question, and then how to do the literature review, how to construct your manuscript, how to read it and proofread it. 50 minutes, I hope by exploring the AI, you will really appreciate the new thing that can come in play to really help you to augment your productivity in AI. Now, to be just disclosure, as of 2023, as of March 2023, AI will not help you to think. AI will not help you to create your questions. AI will not produce that content by itself. AI will not proofread and read your article for you. AI will not really get the promotion or the degree you're looking for if writing research is your target. This is as of now. Who knows in 6 months from now? So GPT, everyone talks about GPT, including ChatGPT or other GPT. I think this is something that is really changing the world. The generative pre-trained transformer, i.e. you put a text and the machine will give you an answer, predicting the text. So the next text will be predicted based on the previous one, so on and forth. So you will expect to have a sentence. Sometimes the sentence doesn't make sense in terms of the context, but it is a sentence generated by the machine. And then again, deep learning, machine learning, artificial intelligence. I'm not the best person to talk about this. So let's ask ChatGPT of how to differentiate between deep learning, machine learning, and artificial intelligence. Let's make it simple. The beauty of ChatGPT is you built a model that you want him to act like. And then, so this is 15 years old explaining this to make it easy. And then what are the differences between deep learning, machine learning, and AI? And I want always to produce a table. And here we go. So you can really understand if you never really think of a difference between these three components of what is AI, what is machine learning, what is deep learning. What we're really enjoying in our daily practice is, I guess, the AI, including the assistant that are available, Siri, Alexa, Google, but the machine learning and deep learning, this is the behind the scene. What's going on.
Everybody wants to rule the world.
Siri is there since 2011.
He wants to rule the world by Tears for Fears now playing.
And it is smart. And it is pleasure. If you look at Google,
Okay, Google.
it's available. It's there
Tell me a joke.
since 2015, probably.
What did the football coach say to the broken vending machine?
Smart.
Give me my quarter back.
Smart. Even if you didn't understand the joke, it's a joke.
Touchdown.
And my best friend,
Lights.
Alexa, it can do so many things. So
You're
this
like sunshine on a rainy day.
thank you. This AI, and they are there since 10 years or more. So now what happened for the last few months? So why AI now, specifically in medical research? So it will really improve the way you look at the literature. It will reduce time, efforts, and cost to support your efforts as a human, increase your productivity. It will improve the writing. Remember, improve the writing. And it will fine-tune your search engines, and it will really come up with high-yield articles, smarter than probably the classic ways. I asked the same question to another beautiful GPT, the same question, and then you can really look at realistic, high-yield benefits of AI these days. The same thing that I can ask ChatGPT, and again, it will give you the same thing. So AI is really an extra hand, an extra loop in your brain, an extra eye to really look at things to increase your productivity. So remember, you will need yourself to really, with your basic skills in research, with your access to e-library and full text articles, and you will need your creativity. You are the one to drive the AI where to go. Let's start now with ABC, simple practice of what is my research question, how to build a solid question, and then how to formulate my PICO. What is PICO? In case you don't know PICO, I'm trying GPT again to really tell me what is PICO, in case you don't know PICO. And look at the beautiful text. PICO, we know, and this is the one that looked at the population, look at the intervention, and then compare it to a comparison, and then assess it through the outcome. This is your first step. To do anything, you have to have a PICO. So imagine you don't really know exactly the details of the PICO. AI can help you to really understand it as long as you ask a specific question. What is PICO medical research? If you ask ChatGPT, and again, I like to really have it in a table, this is the PICO, and we all know. So this is your start, you know it. If in case you are really not unclear what is PICO, GPT can help you. So now me helping myself, me helping me, I came up with this question, like as a human. I want to see the association between development of psychiatric symptoms following temporal lobe epilepsy. We will drive this the next hour or so around this topic. So I created the problem. Now I need help, I need assistance. I asked ChatGPT again, and I give it a very specific question. Act as a neurologist. And writing a manuscript, like you can tell him you are an expert in this area. And I want you to suggest a research question and produce the PICO for my problem. And I just put my problem again, which is psychiatric symptoms following temporal lobectomy for epilepsy, for temporal epilepsy cases. And again, like ask him to construct the PICO. Let's look at the output. It proposed a title, very beautiful. It gave an introduction. I never asked for introduction. You have to read the introduction, make sure it makes sense. And then here is the PICO. The population is patient with temporal lobe epilepsy who underwent temporal lobectomy for epilepsy surgery. The intervention is surgical resection of the temporal lobe. The comparison is no surgery or control group or medical therapy. And the outcome is development of psychiatric symptoms. This can't get any better. But hey, I'm greedy. So I ask it to, let me just play. So I ask it to, let me just see here. I ask it to try again, like I want to see another options. Here we go. So maybe it's the next slide actually. So I asked him to try again. I'm not pleased. Now look at that, try again, effort produced by ChatGPT. It is thinking, it have this time to thinking again, the impact of temporal lobe. So now a different title, still beautiful. Give an introduction. Thank you. It gives some facts. You have to verify these facts are real. Although I never told him anything about temporal lobe epilepsy, this is generated itself, but double check, always double check. Let's look at the PICO now. Now, the same population, temporal lobe epilepsy patient. The intervention is surgical resection. The comparison is pre-surgical psychiatric symptoms. This is beautiful. Now it thinks of pre-surgical and post-surgical, and the outcome is change in psychiatric symptoms post-surgery. So now it really indirectly proposed a different study design, like the same group. I want to have a baseline psychiatric assessment, and then they go for temporal lobe epilepsy surgery, and then I will assess again the psychiatric symptoms post-op. This is nice. Let's go through one of the beautiful tools, which is Elicit. I put my same problem. Now I wanted to brainstorm research questions. Look at the output. Beautiful 5 suggested questions that I totally liked. This is elicit.org. This is a very nice tool to really start with asking a question, and then let's see what else it can do. This is free. I think there's a paid package, but this is free, can help you. I throw the same thing, like suggest 5 research questions to my topic, to another nice tool, and I think very reasonable research questions. This is another very nice tool. Actually, the problem is you have to enroll to get in the list, but it's worth it. So I asked to outline my research work, given the same problem. Look at the organization of thought, definition of epilepsy, temporal epilepsy, overview of epilepsy surgery, and then rationale exploring the association between psychiatric symptoms and temporal lobe epilepsy. And then the suggested literature review to tackle the literature review of temporal lobe epilepsy, psychiatric symptoms before and after. And actually it goes on with methodology, results, conclusion. So I think if I start with the 2 sections, the introduction, literature review, I think I really have a nice guide to really drive through this problem. This is lex.page. It's worth really investing. And actually now it is using ChatGPT 4. So now AI helped me to generate my question, generate more questions, although I created the question, and I have to look at the suggested questions and see which one fits my need. Now, the beauty begins with literature review. And let's find the relevant paper. Let's organize our thoughts and then start working on the introduction. And then I consider whatever literature I got to the discussion at the end, because the methodology is what you really did. And it's customized according to what you did. I can help you to rewrite, rephrase your methodology, but let's start with the literature review. PubMed is your start to me. So I will just go classic way. My question again is temporal lobe epilepsy, epilepsy surgery, and psychiatric symptoms. I will do like subject heading, type search, temporal lobe epilepsy, and then epilepsy surgery, and then psychiatric symptoms. And this is a standardized way to really look at to test literature through PubMed. So here you go, and then just be careful, and just to look at the search terms that I used, and let's look at the output. Nice literature. I 500 something from 2000 till 2023. There are some reviews. There are some very nice high yield. Look at this number 4, 2022 really fits. And then look at the one next to it, 2021. It looks to be interesting. So now I'm eyeballing, I'm screening the literature. This is also a good thing to do because it is mood. So it understood I need mood, not necessarily psychiatric, like, I mean, different type of psychiatric symptoms, so on and forth. So very nice, very reasonable. This is before the era of ChatGPT. This is very nice, high yield. I'll just maybe look at reviews more because I want to enrich my text of the introduction. So I just want to minimize my output to review, and now about 75 articles. Again, I can scroll it and then decide which one to go. This is no brainer. You can also use Ovid or Web of Science, or you can use Scopus to really come up with this. So now, again, I scanned the articles. I looked at the abstract. You can look at the abstract through the PubMed. And I want to do it the way I think I'm more comfortable. Just put it in like a scratch. I collect these articles, export it as a Word file to work on it sometime. So this is human work. This is human work. Let's do AI-powered literature review. I asked the same search term that I threw to PubMed to ChatGPT because I thought ChatGPT is smart. And it wasn't. Look at some articles related to your search terms. They're not. They don't match. And some of them are not real. If I copy paste and go to Google Scholar to look up these articles, some of them never existed. So thumbs down, ChatGPT. I rephrase again. I want to give him as a neurologist, blah blah blah. And again, it is no different. So you have to be careful. You cannot 100% count on these tools, as is over believing in these tools. I tried another very nice high yield, maybe underrated. I think it's underrated. So you.com. This is another AI search engine. It's Google, but with a search engine. I threw the same search terms, and actually I got better results. Like, it only gave me 5 articles. Maybe if I specify, give me 10 articles or 20, it may help. But this is verified results because it linked it with citation to the PubMed. So again, but it's only 3. PubMed give me way better results, but this can help. If you are doing systematic review with this output, you cannot believe AI. You have to really do it the standardized way. So this is thumbs up to you.com. I went back to Elicit, and I threw the same question now, and then I start to search the literature. Look at the output. So now I have the articles. I organize it as per date. It gives me an abstract of the results, and then it's given me even the main findings, which is something interesting, like 3 points, findings of the article. This is beautiful. This is nice, actually. And again, you can scroll down the other articles, and like I think this is high yield reading because I got the article, I got the main study design, and then I have some summary that I can look up. And you can go on, look at different articles. You think, this is really smart. This is really helpful. It saves me a lot of time if I just look at 4 or 5 articles with main summary, and then I can think of where I'm going based on the top 4 or 5 recent articles around the topic. And if you look at the article, they're really to the point. Like, they really tackle my question, like on really. You can really drive even with this Elicit in other measures. Is you can look at number of participants, what is the intervention, and what have you. So this is smart. This is an extra thing that you can do that you will not do with PubMed as of now. You never know what will happen in the next few months. Okay, so now let's I will just examine the first article. I've clicked into it, and now there is a very nice abstract. You can go through it. Let's explore something new. So here, this is a critical appraisal of the article itself. What did they do? What the outcomes measures? This is very nice. What are the population? This is really patient with temporal epilepsy. Very nice. Can I trust this paper? As if this is critically appraise this content. And you can decide if you want, yes or no. And because this is a recent article, there are not a lot of citations. Now let's throw some questions to this abstract. And I can make it like a natural language. What is the downside of surgery? Development of new psychiatric symptoms or worsening of existing one based on the abstract. Beautiful. How common is psychiatric symptoms? And let's ask. No comment to mention. This is based on this. Let me rephrase. The prevalence of psychiatric symptoms, according to this article, the prevalence is about this, which is again based on the article. So I rephrased and I got a better result. Of course, I want to ask about the main conclusion of this article, although you can read it quick, but let's just see if I can have rephrased that I can use somewhere else. The number of patients with comorbidity decreased. Interesting. Nice. So now you can make your mind what is the main objective of this article and how did it help you. So I just tested another article again. This is 2014 because I want to show you an article that has some citation. This is the summary again. And you can do the same thing. Can you believe it? What are the outcomes? Can I trust this article? Or there are only 14 participants, so I don't like it. See, this is generated by the app itself. So now there are some possible critique about the citation of this work, and you can see who agreed with this, who disagreed with this. So this can really give you a vision of how can I use this article to support my idea or to contradict my idea, because you always need to compare and contrast. Another thing very beautiful, if you look at this left upper corner, it already generated summary of the top 4 articles. Let's look at the summary. This is AI generated. This is very valid. This is not made up by Illicit because he has the text, and now as if it is rereading the text and come up with a concept. This is a very good start. This is a very nice piece that I can edit, modify, and work on for my introduction if I want to tackle specific review about psychiatric symptoms in temporal epilepsy. Beautiful. Now, another good tool that I'd like you to explore is the Research Rabbit. Something we will explore, we will learn in the near future is look at the literature review visually, and let's explore this. So now I throw the same question, and it goes through PubMed and other sources to start finding results. So it says PubMed. I start then visually collect some articles according to the title. I'm not able to read the abstract, but at least from the heading, and then let's drive through this. So I just again pick, and then it's added to my collection, and then let's just carry on. Maybe I collected 4, 5, 6, maybe 12. If you, I think the more you find related articles, the better the result will be. The better the next stop will be. I think this is what it is. Now let me just go to the main thing. So now, if you look, here I formed this collection. It come up with this articles that I already picked. Beautiful is I pick whatever article, the same title, there's some abstract. Now, the power of this is with similar work. Now it will connect you to literature related to the same work, more or less. You have to examine this yourself. You have to look carefully, sometimes related to temporal epilepsy itself, sometimes related to psychiatry and temporal epilepsy, sometimes temporal epilepsy, psychiatry, post-operative complications. You really have to be careful, and you can really drive through this. You can look as per year, and then again, you may collect more data as long as you really now have an idea of which articles I can use to build up my theory, to build up my hypothesis, to support, to contradict my literature review that I'm going to use in introduction. I can utilize when I'm doing my results to compare and contrast my results to what is in the literature. This is what I'm talking about visually, looking at the citation, literature review. I think this is something that we should get our eyes and brain used to it. so on and forth. So this is very nice tool. I will fast forward. You can search by authors. You can really search. You can filter by years. This is fun. This is fun. Back to illicit. Let me now dig more into one of the interesting articles that I thought maybe it will give me in-depth understanding of my problem. So I will pick the first article that I liked because it is recent and it is really to the point. Not necessarily I'm going to be biased because I picked the one that showed improvement of psychiatric symptoms following surgery, but because my research question is open, it can carry the chance of increase psychiatric symptoms, no change in psychiatric symptoms, or less psychiatric symptoms. So now I will have an open access, and you should have an access, well, not open access, you should have an access to the article, to literature. So that's why I just went to Science Direct as a source of this article, the database, and I scrolled just looking around. I'm not reading it, but I was just looking at, I'm truly having a full access to the article. Then I guess I need to work on this article to do smart reading. I will look at it more AI assisted. So I picked the PDF of the article, and then I go to this humata.ai. Simply, it is ChatGPT of the paper. So ask AI anything about your files. Here I'm uploading a scientific article. You can upload any PDF file, whatever the content of the PDF file, and start working on it. Let's see. So this is the article. Now it is chat. I start talking to my article. How many people were studied? I just want to show you how you can just have fun with these tools. We start from simple to complicated. So 141 patients, and then it can give you where exactly it come up with this idea. What was the inclusion criteria? I think this is an important question if you are looking at any article, for example, and now look at the response. The text never provided a clear statement. However, they included patient with 1, 2, 3, 4, 5. So this is indirectly a smart answer to the inclusion criteria. What was the study design? Okay, although you can tell from the title, but let's see how rich, how smart is this tool. The study design was prospective longitudinal follow-up. This is great. And not only like a simple answer, it is really smart, thorough answer. More questions. How good was this study? And we know when you ask about how good, how bad the study, the quality of evidence, look at the response. And you can see this a lot. As an AI, I cannot provide an opinion. Yet, now it's explained it is a 1 year or 2 years perspective, and then it's stated the study design is valid, is good, based on the understanding of my natural language question. What was the main conclusion? Of course, you want to ask this question. Let's see what's going on. The main conclusion of the study is 1, 2, 3, 4, 5. Is it a lot too wordy? Maybe I want to summarize it. Let us push this AI and then summarize the findings in 200 words. Let's see. Maybe this is 200 words, but let's see if it is shorter than this. I mean, we're playing with the tools here just to explore, because this is high yield tools. The study, blah, blah, blah. It is more like, it looks longer than the previous page, but it is very fruitful. It is really to the point, and it is rephrased. You can copy paste, rewrite, and you will have a really genuine article. Now, provide a summary and bullet points and key messages, because I want to push. And I just want to say probably 5 points only. Let's see. Number 1, the study is following blah, blah, blah. Number 2, number 3, number 4, number 5. You can even summarize it even more if you push further, but this is very handy. This is a very nice way to really look at how you can smartly read articles. Let's try Bing now. If you have no access to Bing, please go and put yourself in the waiting list. Bing can read the article, whatever web page. So I'm asking him, what is the study design? Because it will read the content and will answer me. Take some time. This is real experience. According to the web page, study is beautiful. This is 100% valid. You cannot say it is making up this because it reads and with some objective methods as the source of this article itself. What are the main findings? Of course, although if you look at the response, it can give you suggested responses based on what you see, which is beautiful. According to the page, 52 patients, psychiatric symptoms before surgery during the follow-up. Wow. Decreased. Oh my God, wallahi, this is fun. And then you can just read this and read this. This is even way better than ChatGPT, in my opinion. This is better than ChatGPT. And it can suggest you other questions, what is temporal epilepsy, but now I want to critically appraise this article. This is really advanced regarding generalizability, study design, and you can just put whatever bias and limitations. Actually, you can put up to 2,000 words in a text, so it can really be rich. Let's see what Bing will do. Search, it search the internet and it search the article probably, and then, I'm sorry, I don't have enough information. However, critical appraisal involves careful system. Now, it's teaching me about critical appraisal. No, it's not my point. Let's try again. About this page in particular, let's see. Will it make it any different? I'm sorry, I don't have enough information. Now, let's go back. I want to copy paste this, and I will rephrase it in a way. I will push Bing. Use this web page, course or website, whatever, to critically appraise. Again, regarding my points, let's see. Based on the information provided in the web content, this article provides a perspective. Now, look at this. In terms of generalizability, the study conducted in a single center with specific patient population, 16, blah, blah, blah. So result may not be generalizable to Allah. This is great. In terms of study design, this study design can provide valuable information. In terms of bias and limitation, it is not possible. This is a very smart tool that you can do. And it is really rich response. And it makes sense because it really reads the page. This is kudos to Bing. Nailed it. Now, this is even more fun. I highlight whatever text and then it starts to identify this text and tell me what you want to do. So I want to send it, and then what is exactly you want to do with this text? Explain, revise, summarize, expand. As if this is like a electricity paper. Let me explain it. Something not related to my area or very technical, even in my area. The selection text provided demographics and clinical information about blah, blah, blah. It explains patient terms, surgery. Text also describe etiology, cause of, with some nice numbers. This is beautiful. This is beautiful. This is beautiful. Indeed. Look at other suggestion. What is hippocampus sclerosis? What is amygdala enlargement? Blah, blah, blah. I just try to really see what's hippocampus sclerosis. This will either answer from the page or from the web page, the internet. I don't care. I will trust what comes out of this. Although, look, the language here is really generic. This is Wikipedia, and there are the sources. I believe it because it is Wikipedia. It had the citations in. Now, again, always push to see how can this AI help you. Now, I will take it from different perspectives. Search for psychiatric symptoms following frontal lobe epilepsy, even if I misspelled epilepsy, look, and compare it to this article. Now, I want to see the critical analysis of the facts I give to this AI. Searching for blah, 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 okay. According to a study of frontal lobe epilepsy, now this is like demographics of frontal lobe epilepsy and psychiatric symptoms. You can have this number. Oh, I couldn't find any psychiatric symptoms, frontal lobe, and mentioned the article. Fine. So, well, I deserve a thumbs up. I want to push it even more. I'm sorry. I want to push it. Yeah, here. I want to push it even more. Let's do. Already have done this, sorry. Now, search for psychotic symptoms following and compare it to this article. We already come across this. Sorry. Now. Okay. Let's look at it. I'm pushing again. Remember, this is pre-recorded, so well, I have the control to do anything with this exercise. Should be next, actually. So now I asked ChatGPT this being to really search for gap of knowledge in this topic, and I specifically relate, like, stratify whatever gap of knowledge regarding agent 6. Look at the result. There are limited evidence about the agent 6 specific differences in psychiatric symptoms of temporal epilepsy. I have to believe this. I have to double check this, but it really gives me a good idea. I want to tackle this topic according to gender or according to sex. Another study found epilepsy, the longer epilepsy, the longer the psychiatric symptoms, blah, blah, blah. This is fun. So AI and understanding and reviewing the literature is just beautiful and entertaining. Now let's generate your first draft. So we drove through some tools. There are more, but let's do it the way as I suggested. I'll go back to this beautiful outline of the study, introduction of the temporal epilepsy or review of temporal epilepsy, and so on and forth. Now I really want to get my hands dirty. I want to really generate the introduction. Again, this Lex.page. This is beautiful. I went back. I'll go back to this elicit. I looked at the main findings of these top 4 or 5 articles, although it's summarized already. This elicit summarized the very nice paragraph. That fact, I'll do it in a different way. So I copy paste all this. And let me show you how did I do. Again, I asked ChatGPT as an academic, use academic style. You're smart researcher with expertise. I want you to compare and contrast the following text, use Vancouver style citations. And I throw this text using the author's name, and you see why. I copy paste. Let's see the output. PE study focused on relationship between temporal epilepsy, surgery, and psychiatric symptoms. And then it started citing each author with, although it's not Vancouver style, but at least I feed it a legit text, and now it gives me a legit summary in a concise way with some references. This is beautiful. You have to read it. You have to rewrite and verify the content. I think the content is already verified because the steps that we come up with this text is already verified. This is very nice. This is very handy. I promise you, if you start literature review, it will take you one day, and then you go fed up, bored, and then you go again and pick your articles, start scanning them, and then start to come up with summary. To take another 1, 2, 3 days, who knows? And then you start to write your introduction. You will have writing block. You will have difficulties. Now these are already. Another source. This is Lex.page. Again, give me very nice summary again. This is beautiful. Let's compare and contrast traditional versus AI literature review. This is my opinion, actually. So literature review as of now, probably AI it looks easier to use compared to PubMed or Ovid or other traditional web pages. The traditional ones are consistent. If you keep searching the same terms, it will give the same results. AI, there are some variabilities. So you have to make sure you really collect your best articles. Accuracy is more with PubMed and Ovid compared to AI. Both will provide with abstract. Full text articles are plus or minus. It depends on the availability of the full text. Summary findings, thumbs up AI. No chance with PubMed as of now. Who knows what will happen in the next few weeks. Appraise the findings, thumbs up AI. No clue with PubMed and traditional ones. The search strategy for the classic traditional tools are keywords or mesh, while AI you can search using your natural language, although you should be and use technical specific language to come up with specific results. I think best start is to start with PubMed. AI you can start, but I guess to play it safe, start with the traditional ones. So here we go. You can do the same we did introduction. Yeah, you can do for the introduction mainly about general talk about temporal epilepsy and then epilepsy surgery, and then you can carry on for the discussion. You use the literature review to enrich it with your text based on the results you found, and then you can really find an abstract to summarize everything by AI or your own style. There are other very beautiful AI tools that I will not come across. Some of them are paid, some of them are free. Like a site is beautiful. You should look it up. It is paid, but it's worth for me. I'm not endorsing anything, but after my trying this, it is beautiful. My first draft is a really nice tool. It can really help you for systematic review. I wanted to demonstrate it here, but for whatever reason, maybe it was a website, it was my internet. It didn't really go through the same steps that when I started first time, maybe because I need to pay, but it is a really, really nice thing to do. Explain paper is similar to Humata. You can talk to PDF, and you can actually talk to PDF and also talk to the internet related to the PDF. So it is a really fun thing to do. I mean, you can use GPT and other AI tools to really, depending on your level of expertise, to come up with study notes, literature review, and then you can scan it, and you really can come up with very nice content. Always verify, read, make sure they are right. Actually, what beats them all is AI Bing. It can come up with tables, with citations, with very verified sources. You have to always check the content, whatever you created, because you have to check. People will check, is it human or AI generated? Journals will check your work, is it AI or human generated? And you could be penalized if it is 100% AI. So you will make it a success story. So I copy paste an abstract that I created from ChatGPT, and 86% it said it's human. Nice. So you can rephrase it to make it more 100%, but at least always check your content. So whenever you use AI to generate content, you have to review, you have to edit, you have to optimize, fact check, trust build, like you really see this is you writing this, and make it more personal. I believe in the next few weeks, in few months, the new literature review research will not be more writing, it will be less writing, more editing and proofreading. So ChatGPT helped me to come up with this riddle. Fewer scribbles, please. Polish with expertise. Verify with great care. Words beyond compare. Time well spent, be fair. With ethics, aware. Plagiarism, beware. Now, last 2 minutes, quick. I want to show you how you can go crazy with data analysis visualization using AI. This is a bit advanced, but as long as we do this, let's explore it. You can ask GPT to show you steps to perform statistical tests in a software of your choice. You can, from simple to complex analysis, you can visualize your data, you can write summaries and interpret findings. Actually, you can capture the caption of the study. AI can generate it based on the code, based on the result that you can provide. You can also capture data, tables, of course. You can do more with AI. Whatever software you're using, SPSS, MATLAB are paid. You can use even Python, open source, but maybe Python is too complicated. It can do way more than a data analysis. So my favorite is RStudio. If you want to get yourself into data analysis, it is where to go. Now I will show you how AI can use R, which is a complicated, advanced data analysis software, to come up with results in no time. So this is rtutor.ai. It's just free, it's available. You can upload your data, Excel sheet through it, and you can chat with your data via AI. Be careful, don't upload files, data that has MRNs, patients' names, for example, because it goes to the server. So make sure it is all generic. So this is example of neurotoxins in different cities in Saudi Arabia. I'm making up this. And the variables are age, sex, head trauma, mental disease, smoking, occupational hazard, and what have you. I will upload this and I will start, go from home, and then this is generated by the our tutor itself. So this is basic descriptive analysis. So cities, it can give me how many participants in each city, what is the neurotoxins, mean, minimum, maximum, median. This is crazy. If I want to do this myself through the R code, I just have to enter the code manually, and then so on and forth. So this is just descriptive, just to show what's going on. Let's make it more complicated now. It will build it in a table with a percentage, like proportion of distribution of each variable. So for example, you can tell for gender, for example, 45% versus 50%. And beautiful. It can show you how many missing data, 0, and total number of participants. Let's go more even complex now. This is an inferential analysis. I'm using I think this is marital status, and to see it with association with other variables. Give me this is the p-value. Now it performs ANOVA test. It performed t-test. It performed again ANOVA test, what have you. So it did the analysis, automated. I only uploaded the file, and here we go with p-values. This is very strong and time-saving. Now this is a correlation analysis. This is for all the numeric variables. Like for example, I want to look at the population density versus average temperature, and it is blue 0.3, which is toward the positive correlation, like modest. But if you look, for example, average temperature and lead level, for example, it is minus 0.7, which is strong negative correlation. So I hadn't done anything other than uploading the file, and it came up with very beautiful correlation analysis. You can also look at bar chart to really describe what it is. Finally, let's just talk to this data. So I can just remove some variables that I don't need, and then I ask him to do the box plot for sex and gender. I added more details. Even if you don't add details, you will see the output very appealing. But then I ask him to produce a regression model to predict neurotoxins using these variables. I just put a text, and then it wrote the code. I can copy paste and work on it on my R software, and then modify it, manipulate it. And even I can modify it and ask GPT again to make it even better or add more to it. Beautiful box plot in no time, with p-value, with mean, very informative. This is the regression analysis. It wrote the formula, and then to predict neurotoxins based on age as my independent variable, adjusted for other variables. Look at the p-values. This is amazing. Finally, I want to write summary of my findings to see what's the best output I can come up with. So I throw this to ChatGPT and ask him to summarize it. Now, the descriptive analysis of health patterns in population sample from Saudi Arabia. This is like, it's generated by GPT. But he put some abstract, and then it started to really embed the results into this abstract. This is beautiful. These are real results because these are my results. And then it started to write some introduction about the topic, fine. Although it's very brief, I never specify in 2,000 words, for example, it may come up with this, I don't know, but at least I'm just showing you here as an example. This is very nice start. This is very nice start. I can expand, rewrite, enrich, and it can really make my writing really easy, assisted. But although I did a great part by collecting the data, I have the research idea. So it is you that drives all this. So again, in 2023, the internet is beautiful. One last minute. If you just want to explore Bing AI, I just want to ask a question of, based on the literature, what is the benefit of epilepsy surgery for temporal epilepsy? And then I want to show you how, I know you may have come across this, but how the Bing, the crazy Bing is giving me the answer. At the same time, you can just go to the classic way, look at the search result from the internet. And nice response, although not really scientific, yani more generic. You can add more extension, ChatGPT, to your browser, and then look at the results. Benefit on seizure control, improve quality of life, reduce medication use, improve cognitive function, improve mental health. This is beautiful. Finally, this is really rapidly evolving. Microsoft is about to finalize a lot of AI-powered Office, so you don't have to pay for this GPT that can generate a Word file. It will be embedded in Word file. Google already has announced this. This all was going on last week. This is so crazy. Utilize free tools first. consider specific what you can hit your needs. Don't be tempted by paid services as of now. Just go free. So finally, GPT will give you the last message of this talk. I will be mute. Thank you for your listening and understanding. It is truly innovating solutions together, and it's really limitless creative potentials unleashed, and it is really empowered ideas, revolutionized healthcare, and what have you. Thank you for being awake and attentive. That's it. Yani 5 minutes more, ya Anas and Asif. Thank you.
Thank you so much, Dr. Fawzi. This is an amazing talk, actually. You spoke and you took us through an ocean. This is like a place with a lot of treasures out there. As if someone in the middle of a desert and he having a good car, but he don't know where to go. You was the driver and you took us through a good trip. Thank you so much. Do you believe that the AI is a cumulative thing, that once you ask the ChatGPT, for example, about one question, then you ask it again next time? So would it be like having the cumulative information? So next time it will know more and more about the topics.
True. And actually, yani, true. You train it even better to the content, not to your style, because it is not, like, it's not your profile, it is your use. And actually, you can, for example, save one big prompt with your basic info each time to remind it, and you can tell him for the next 10 questions, answer this. So true, you can train it even better if you feed it more questions. Absolutely.
So you mean that we can use one account to ask AI, or even if you ask it through different accounts?
I mean, well, I don't know if it is account related. I don't know from technical point of view, but you can really tell the first time, is it because we get better using smarter prompt, or it is really getting smarter? It is definitely getting smarter. So either way, I don't know exactly, is it my account or is it is AI, the GPT itself, but it is getting always better. Absolutely.
We got a lot of feedback and question and comments. So one of the few things we had like suggestions or a question about the link for this session. So we will get this recording and we will publish it in our channels, Neurology Solutions channels in YouTube. So there is one question asking about the articles that we get through AI. Would it give the access to the open access only, or all the articles?
No, I mean, what is open access is what available. It cannot get to subscription based as of now. I'm sure the university will put this into AI, but as of now, it is only open access. No.
Okay, there is an interesting question. Can I give the AI my research result and make it write? He said, make him write the discussion for me.
Yes, but you have to guide him. These are the headings. These are the aspect of the discussion. You can try it. Of course, it can do. Even being AI can do, of course. Yes.
Abdulaziz is asking, how can we tackle the problem of accuracy in research?
How can we tackle?
You mean, like, as you mentioned, I did it before, and I found like I asked about references for some questions, and they give me a format. I thought it's real. Then when I went to it through a lot of like PubMed and Scholar, Google, and a lot of search engine, and it did not find it. So it's not real. So this might be his question, Abdulaziz. How can we deal with it?
And when I tried to this, I was really surprised. It gave me really nice citation, but it is fake. So I go back and look at the point that it is discussed. I go to Google Scholar. I found 1 or 2 articles, and I use it for my citation based on the generated text by AI. So always verify, always fact checked is a must when you use AI. As we learn from these tools, I think Bing AI will give you more verified citations. Again, based on the PubMed, because it can access PubMed live. So you have to really be careful. You have to really be careful. This is you helping you.
One question directed to you, Dr. Fawzi. They're asking, did you publish any article using AI yet?
لا والله.
No, not yet.
I responded to reviewers based on the AI, and I really enriched my response. I'm waiting for the reply, inshallah, soon. But as of now, no. But hey, I will do it. I'm not cheating. I'm not plagiarizing literature. I'm having an extra hand, extra loop, extra eye. I don't care. I'll do it.
Yes. So just to emphasize that AI will not be doing the research job. It is a tool then. So we need to revise that. We need to create the questions. So it will help us. So it will not do all the job. You agree with that? Okay. A lot of good comment about your good presentation. So is it legal to publish research using AI?
Now, if you go to PubMed now and search ChatGPT itself, you really, I mean, the literature is rich now. I mean, you will be penalized if it is GPT per se. I mean, people are having different opinion about the ethical use of ChatGPT itself. I mean, I don't think you should really count 100% on ChatGPT or other GPTs to come up with your article. I mean, you could be, it is, I guess you would be penalized as if this is plagiarism to some extent. I mean, it is really a big storm now, but we should be very careful. And the exact answer we will learn in the next few months, but you should be careful. Don't ever count 100% on GPT to generate your content. Absolutely not.
So this is like a similar question, but in a different way. Does a scientific paper reject, the scientific journal will reject my paper if I use the ChatGPT for writing all the paper? I don't think that we can write all the paper from A to Z using AI, but if we use it in somehow, would they reject it?
Well, now there is this AI detector, I'm sure. As of now, if you look at instructions, nobody yet put, I mean, avoid plagiarism, avoid GPT-generated, AI-generated as of now. But I'm sure this AI-detected tool are really evolving, and you will really have a bad time getting a paper accepted by GPT. So I'm sorry, I don't want to say, don't be lazy. Use AI to help you. AI will not do your job.
The language that is used by the ChatGPT is a good language, actually. So how if someone is using the AI to rephrase what they're finding in the other paper? Would that be a good idea?
You mean, how can I use this GPT to rephrase it? Well, I just take GPT output as is.
No, like if someone is having information from few references and they just need to rephrase it, there are a lot of people that are speaking English as a second language. So if they use the AI to rephrase it, would it be a good idea?
Yes, but make sure you tell him at the beginning, use academic tone, professional style, act as a senior researcher, put him in a mood, and it will really give you the output fits its profile. Because think of GPT, it's a 1-year-old baby, 5-year-old baby, 50 years old, illiterate, and smart Nobel Prize winner researcher. So you put him in a profile, and you can also tell him, I want you to help me to write this manuscript. I'm submitting. Sometimes you can't even put to the particular journal because it is trained to know the style of the journal. So as much specificity you hit GPT, it can really give you good results, for sure.
Okay. There's someone is complimenting your template or software. What's the template or software did you use for this PowerPoint presentation?
AI generated. I'm not cheating. This is AI generated class. Hey, it made it impressive. Thank you. This is AI generated, by the way.
Okay, so ChatGPT, for example, cannot generate video or pictures. It's just give you like an instruction and text. So what's the thing that can help someone to generate a PowerPoint presentation using accurate pictures? We can.
But let me just correct this. GPT-4 released, paid, it can generate pictures and it will generate videos, but it is still just released this week. If you want to generate, think of it, if you want to generate medical pictures, I mean, there are a lot of this now text to picture tools. I've never tried it. I mean, they're all paid. I will hold on myself, but at least you can, I don't know how good method. For example, I want to just the anatomy of the circle of Wallace, for example, because it is well known. It will draw it, but it will draw it fake. If you look at that YouTube, it will just draw it in its own imagination with more or less around it. So I don't know how good it is. I mean, for our, as a medical field, in our, most of our research will be text-based diagrams, tables, maybe engineering, other specialties, they have more pictures. So I don't know how good the medical images that can be used to enrich our medical research. So I don't know.
Okay, so we have to stick with the time. Sorry for anyone that we could not read their comment or questions. So as there is another question, so where can we find this recording? It would be in the Neurology Solutions social media. It is in LinkedIn and Twitter. Soon we will upload it in YouTube channel, and we will put the link there. Neurology Solutions would like to thank Dr. Fawzi Babtain for this wonderful talk, and we'd like also to thank Academy of Sciences for organizing this session. Thank you all for your attendance, and we will try to arrange another sessions for AI and for other useful topics in medicine. Thank you again, and see you soon.
شكرا.